Hi, my name is Bria Gresham, and I'll be presenting on the manuscript entitled Interactive Effects of Neighborhood Safety and Screen Time on Adolescent Internalizing Symptoms, which I co-authored with Doctors Benjamin McManus and Despina Stavrinos. Approximately 50% of mental disorders present by mid-adolescence, making this developmental period a time of significant risk. Both perceived neighborhood safety and screen use are independently associated with anxiety and depressive symptoms. And perceived neighborhood safety is also associated with higher levels of screen use. Screen use may be a mechanism by which the effects of neighborhood safety on internalizing symptoms differ. But despite these robust independent associations, research hadn't previously investigated screen time as a moderator of the relationship between neighborhood safety and anxiety and depressive symptoms. Thus, the primary study had two main aims. First, we sought to replicate previous findings by investigating the direct effect of perceived neighborhood safety and screen use on anxiety and depressive symptoms. Consistent with previous research, we expected that perceived neighborhood safety and screen use would predict higher anxiety and depressive symptoms. Secondly, we aim to extend previous work by examining the interactive effect of perceived neighborhood safety and screen time on anxiety and depressive symptoms. We expected that high levels of screen time would exacerbate the effect of living in a neighborhood perceived as less safe on anxiety and depressive symptoms. 184 participants that were aged 16 or 18 at the time of study enrollment were recruited from a mid-sized metropolitan area in the southeastern US. The participants were 53% female with an average age of 17 years old, and the sample was predominantly African American. Participants reported their demographic information, current perceptions of neighborhood safety, average weekly screen use, and anxiety and depressive symptoms over the previous 2 weeks. Overall, adolescents reported high levels of perceived neighborhood safety and also reported high levels of screen time, with an average of 7.6 hours per day spent engaged in screen-based behaviors. To answer our primary research questions, we used hierarchical linear regressions, and we found that higher perceptions of neighborhood safety predicted lower levels of anxiety and depressive symptoms. Additionally, higher anxiety and depressive symptoms were predicted by higher levels of screen time. The interaction between perceived neighborhood safety and screen time was significant for anxiety symptoms, but not depressive symptoms. We conducted post-hoc probing of the significant interaction via simple slope analyses, which revealed that lower perceptions of neighborhood safety was associated with higher levels of anxiety only for adolescents with high levels of screen use. These findings indicate that identifying adolescents at risk of internalizing symptoms due to low perceptions of neighborhood safety and/or high levels of screen use is critically important. Additionally, given that high levels of screen time are associated with internalizing symptoms, clinicians may consider interventions that aim to reduce screen time. Future work should evaluate this relationship with the content and context of media use in mind. For instance, passive screen use, such as TV viewing, and active screen use, where youth engage with others, may have differential effects within the neighborhood context. In general, longitudinal work is needed to further understand the implications of these findings. I would just like to take a second to thank our funding agencies and also a special thanks to the UAB Translational Research for Injury Prevention Lab for their assistance with data collection and entry. And a special thanks to Sydney Witt of the Trip Lab for her assistance with data preparation for this manuscript. Finally, a special thanks to Dr. Andrea Underhill, who provided feedback on an earlier version of this manuscript.